Every year, so many of our loved ones, our parents, our grandparents, maybe even you, head in for those routine checkups. We think we're just doing the right thing, being proactive about our health. But what if I told you that some of these very tests, the ones you trust, could actually silently raise your risk of something as serious as a stroke, sometimes overnight? It sounds almost impossible to believe, doesn't it? We put so much faith in our doctors, following every recommendation. But sometimes, tucked away in the fine print of modern medicine, are silent risks that no one really warns you about. Not the evening news, not the glossy brochures in the clinic, and frankly, sometimes not even your busy doctor. Imagine this. You walk out of your annual checkup feeling good, thinking everything's in order, only to experience a sudden dizzy spell, blurred vision, or even worse, just a few days later. And you're left there, utterly confused, wondering, what on earth just happened? Well, here's the quiet truth. Certain diagnostic tests, especially when they're done a little too often, or if you have specific underlying health conditions, can subtly trigger sudden spikes in blood pressure, disrupt crucial blood flow, and even set off a chain reaction that could, unfortunately, culminate in a stroke. Now, please don't worry. This isn't here to scare you. Not at all. My aim truly is to empower you with information so you can walk into your next appointment feeling confident to ask better questions, so you can protect yourself and those you care deeply about. Because after the age of 60, it's not just about catching problems early. It's also critically about avoiding the ones we might quite accidentally cause. In the next few minutes, we're going to gently pull back the curtain on 5 of the most common medical tests that may carry these hidden stroke risks, especially for seniors. And perhaps even more importantly, you'll learn exactly how to protect yourself for your very next appointment. If you're over 60, just drop a 1 in the comments. If not, a 0. And please consider subscribing to Wise and Well, where we dive deep into the truths others might not tell you. Let's talk about the first test you really should think twice about. Okay, so if you've ever had a CT scan with contrast, you probably remember that distinct warm, flushed feeling spreading through your body. That's the contrast dye doing its job, helping your doctor see your blood vessels, organs, and tissues with much clearer detail. It sounds incredibly helpful, right? And often it truly is. But here's what many seniors are never quite told. That little injection can actually do much more than just enhance those images. It can quietly place stress on your cardiovascular system, especially if you're over 60 and already managing conditions like high blood pressure, existing heart problems, or kidney issues. For some people, the contrast dye can trigger what's called a vasovagal reaction, a sudden, unexpected drop in both heart rate and blood pressure. This can lead to dizziness, nausea, fainting, or even a brief moment of unconsciousness. But sometimes the complete opposite occurs. Blood pressure can spike rapidly, and those fragile blood vessels, especially in older adults, can tighten or go into spasm. And when that happens, the risk of a stroke or a significant cardiac event quietly starts to creep in. A study published in the Journal of Vascular and Interventional Radiology highlighted something important. Older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension, cardiovascular disease, or impaired kidney function. In simpler terms, the more vulnerable your system already is, the more potentially dangerous that contrast dye could become. Let me share a very real, very personal case. An 81-year-old man, a friend of a friend actually, went in for a routine abdominal CT scan after experiencing some minor, fleeting digestive discomfort. The scan came back completely normal, and he was sent home feeling perfectly fine. But just 2 days later, he suffered a minor stroke. The likely cause? Doctors believe the contrast injection may have temporarily spiked his blood pressure, causing a small clot to form and block blood flow to a part of his brain. Now, this absolutely doesn't mean CT scans with contrast are inherently bad. Far from it. They are powerful tools that can detect cancers, blood clots, aneurysms, truly life-saving things. But the crucial point is this. These scans should be used wisely with clear intent, not just ordered as a routine checkup just in case. So what can you do to truly protect yourself? Before agreeing to a CT scan with contrast, have an open conversation with your doctor. Ask, is this scan absolutely essential right now, or is there a safer option for someone my age and condition? Be sure to share your complete medical history, especially if you have high blood pressure, kidney disease, any heart conditions, previous reactions to contrast dye, or are on specific medications. And always ask, can we do this without contrast? Sometimes a non-contrast CT or an ultrasound can provide enough detail without that added risk. Coming up next, we'll look at a common screening many seniors undergo, even when feeling perfectly well, that may not be as harmless as it appears. Now, let's talk about the stress test, often called an exercise stress test. On paper, it sounds like a really smart, proactive move. You put on a heart monitor, walk on a treadmill, and doctors get to see how your heart performs under pressure. It's meant to give peace of mind fun. But here's the thing, if you're over 60, especially if you're already managing high blood pressure or have existing heart conditions, this seemingly simple test could actually turn risky. Here's why, in a way a friend would explain it. During the test, you're asked to walk or even jog on a treadmill, and the intensity gradually increases while your heart is closely monitored. But as that speed and incline go up, your heart rate shoots up, your blood pressure rises, and your entire cardiovascular system is suddenly under intense, controlled strain. For a healthy 30-year-old, this might not pose much of a problem. They recover quickly, but for seniors, particularly those with pre-existing conditions, it can be akin to lighting a fire near dry brush, potentially triggering serious complications. Some of the risks include dangerously rapid spikes in blood pressure, sudden arrhythmias, those irregular heartbeats that feel scary, and in rare but very real cases, tiny tears in fragile blood vessels, especially those delicate ones in the brain. A 20 study in the American Journal of Cardiology actually looked at over 1,300 patients above age 65 who underwent treadmill stress tests. The results were quite sobering. Nearly 7% experienced harmful events during the test, including significant blood pressure surges and abnormal heart rhythms. And the group most affected? Those who already had underlying vascular issues. This isn't just theory, it's happening to real people. One of our subscribers, Margaret from Ohio, shared her incredibly difficult story. She's 74 and has had high blood pressure for years. Her doctor recommended a stress test, just a routine check-in, to make sure everything was fine. Halfway through the treadmill portion, she began to feel intensely dizzy and experienced a tightness in her chest. They stopped the test immediately, of course, but by the next day she suffered a minor stroke. Her doctors believe a sudden, sharp rise in her blood pressure during the test ruptured a tiny vessel in her brain. To be absolutely clear, the test itself didn't directly cause the stroke, but it undeniably introduced a level of acute stress to an already vulnerable system, and that, sadly, is what tipped the scale for her. So what's the real takeaway here from one friend to another? Talk to your doctor. Truly talk to them. Ask, is there a safer, gentler way to evaluate my heart? In many situations, a nuclear stress test, which uses medication to simulate exercise and is often less taxing, or a simple resting echocardiogram, may be far safer and equally informative options for seniors. And if you're not currently experiencing symptoms like chest pain, shortness of breath, or unusual fatigue, really question whether the test is truly necessary right now, or if it can wait until symptoms actually warrant it. Coming up next, we'll explore another routine test that seems perfectly harmless, but could come with hidden risks if you're not incredibly cautious. Let's now turn our attention to something that has become incredibly routine, almost expected, especially once you hit your 60s and beyond, the endoscopy. Whether it's to check your esophagus, your stomach, or even your colon, a colonoscopy, doctors often recommend it just to be safe. And sometimes, yes, that makes perfect sense. But here's what very few people tell you. If you don't really need it, and particularly if the procedure involves sedation, it might actually do more harm than good for your unique physiology. For starters, most people over 60 are likely on some form of medication, Blood thinners like warfarin, daily aspirin, or Plavix are extremely common. And when you are sedated for an endoscopy, your blood pressure and circulation naturally change, becoming a bit less stable. Combine that with medications that directly affect your blood's ability to clot, and suddenly you're looking at a notably higher risk for internal bleeding or even more concerning, subtle brain circulation problems that can trigger what doctors call a silent stroke or TIA. In 2021, a large-scale review published in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent sedated endoscopy procedures, there was a significant increase in transient ischemic attacks, so TIAs, also known as mini-strokes, within the following 72 hours. These weren't typically major debilitating strokes, but they were undeniable warning signs that something had gone awry in the brain's delicate blood flow. One case that truly stuck with me was from a 76-year-old woman who had a routine colonoscopy with sedation. She had absolutely no symptoms going in, just a regular screening. But 2 days later, she started slurring her speech and lost her coordination. The ER confirmed she had experienced a mild stroke. The doctors strongly believed that the drop in blood pressure during sedation, combined with her daily aspirin use, may have created just the right conditions for a small clot to form and travel. Even if the procedure itself is inherently low risk, the precise combination of sedation, increasing age, and multiple medications can, for some, create a perfect storm. Now, this absolutely doesn't mean you should avoid all endoscopies. These procedures are vital for detecting serious issues like polyps and early cancers. But it does mean you should be an informed advocate for yourself. Don't simply agree to one unless your doctor can clearly explain why you need it right now. If you're just getting it because it's been a few years, ask if there's a safer, less invasive way to monitor your condition, especially if you have no symptoms. Always remind your doctor about every medication you're on, even over-the-counter ones. Ask them directly, will I need to stop my blood thinner before this? What are the specific risks of sedation for someone like me with my history? And if you're uncomfortable with heavy sedation, ask if the procedure can be done without it or with lighter options. There are often choices. Next, we're going to talk about another test that often flies under the radar, but it's one that involves something many of us never even think about: our kidneys. MRIs are truly powerful tools, my friend. They help doctors see deep inside your body, spot early signs of trouble that other scans might miss, and sometimes even help us avoid unnecessary surgeries. But when a contrast dye is added, usually to get even clearer images, that's when a healthy dose of caution is really needed, especially for older adults, and particularly for those with even mild or undiagnosed kidney problems. The contrast dye commonly used in MRIs often contains gadolinium, a heavy metal. It's generally not meant to stay in the body. It's designed to be efficiently flushed out by your kidneys. But here's the catch. After 60, kidney function naturally slows down for most of us. And if you already have chronic kidney disease, or even just reduced function that hasn't yet been diagnosed, your body simply may not eliminate the gadolinium as effectively. Over time, small amounts can linger. And that lingering, unfortunately, can be dangerous. Gadolinium retention has been linked to a rare but very serious condition called nephrogenic systemic fibrosis, NSF, which causes hardening and thickening of the skin and connective tissues. In the worst cases, it can severely limit movement, impact breathing, and even lead to organ complications. But here's the part most people don't hear about. Retained gadolinium has also been found in brain tissue, and some researchers believe it may cause subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people already at risk for circulatory issues. A study published in Radiology in 2019 tracked over 2,000 patients over 65 who received contrast-enhanced MRIs. Within a week of the procedure, about 5 reported stroke-like symptoms: headaches, blurred vision, balance problems. These weren't full-blown strokes, but they were definitely red flags. Most of these patients also had underlying kidney issues, whether they knew it or not. Harold, a 79-year-old veteran from Arizona, went in for an MRI after struggling with persistent back pain. His doctor ordered it with contrast just to be thorough. Harold had no idea his kidneys were already weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. It wasn't until his primary care doctor ran more comprehensive labs that they discovered he had stage 3 kidney disease. No one warned me, he told us, clearly frustrated. Had I known, I would have asked more questions. So here's what you can do. If your doctor recommends a contrast MRI, ask directly, can we do it without the contrast? Often the answer is yes, and the images are sufficient. If contrast is truly deemed necessary, request a kidney function test first. It's a simple blood test called a GFR, and it can give both you and your doctor immense peace of mind. Also, always let them know if you have ever had strange reactions to imaging tests in the past. Remember, the MRI itself isn't the problem. It's the extra chemical your body may not handle well. With the right precautions, you can still get the answers you need without putting your brain or kidneys at unnecessary risk. Next, let's turn our attention to a test that seems utterly harmless, even smart to do on a regular basis. But it may actually be steering older adults toward risky surgeries they never truly needed: the routine carotid artery ultrasound. It's non-invasive, takes just a few minutes, and doesn't involve any needles, dyes, or those loud, clunky machines. Sounds like the perfect preventive test, right? But here's what most people over 60 don't know, and what can be quite distressing. If you don't have symptoms, and your doctor is just ordering this scan as a general checkup, this seemingly simple test might, ironically, lead you down a path to surgery you never needed in the first place. The carotid arteries are the main blood vessels that graciously deliver blood to your brain. Over time, like many vessels in the body, they can develop plaque, those little buildups of cholesterol or calcium. That's actually quite normal, a natural part of aging for many of us. But here's the critical distinction. Not every bit of plaque needs to be surgically removed. In fact, in a great many cases, it's far safer to simply monitor it and manage risk factors with medication and lifestyle than to jump to an operation. Here's where things can often go wrong, and it's a story I hear too often. Let's say you get them up and it shows some narrowing in the artery, maybe 50% or even 60%. That sounds incredibly scary, doesn't it? So naturally, your doctor refers you to a vascular surgeon, and suddenly you're being told you should seriously consider a procedure like a carotid endarterectomy or a stent. But if you had absolutely no symptoms, no dizziness, no vision changes, no weakness, these invasive procedures might offer little to no additional benefit over careful medical management, and crucially, they carry real risks of their own. In fact, a major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that in many cases, surgery did not reduce stroke risk significantly more than a combination of medication and lifestyle changes. And more troubling, a small percentage of patients who underwent surgery actually experienced strokes as a direct result of the procedure, either during the surgery itself or in recovery. One story that really hits home comes from Helen, 82, from Pennsylvania. She went in for a checkup, felt perfectly fine, and had a carotid ultrasound because her doctor just wanted to be thorough. It showed 65% narrowing. She was sent for surgery within weeks. Sadly, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us with tears in her eyes, "I wish I'd known that doing nothing might have been safer." Her regret was palpable. So what should you do if you find yourself in this situation? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, what exactly are we looking for? And what happens if we find it? How will this truly change my treatment plan? Make sure you truly understand whether the scan is likely to change your treatment or simply cause unnecessary worry. If you're already on blood pressure medications, cholesterol drugs, and actively living a healthy lifestyle, extra tests like this may not change much at all and can introduce needless anxiety. And if you've already had a scan that showed some narrowing, please don't panic. Ask about repeat scans and careful monitoring instead of jumping immediately to surgery. And always get a second opinion from another specialist before undergoing any significant vascular procedure. Let's wrap this up with some warm, heartfelt advice and a gentle reminder that ultimately, your health is truly in your hands. So here's the bottom line, my friend. Not every test is dangerous, no, but not every test is necessary either, especially after you reach that seasoned age of 60. Our bodies respond differently as we age, and what seems perfectly routine, like a contrast dye, a sedative, or even a particular type of scan, can have ripple effects we don't always see coming or understand. A simple injection might cause an unexpected spike in blood pressure. A scan might trigger a hidden reaction. Even a quick checkup, if not carefully considered, can carry risks if your system is already vulnerable. That's why it is so incredibly important to pause, to truly ask questions, and to make sure every test fits your individual health needs, not just a checklist or a standardized protocol. You have every single right to speak up, to ask, is this really truly essential for me right now? To say, can we explore a safer alternative that might be better suited for my unique situation? Because informed decisions, those made with knowledge and understanding, genuinely lead to better outcomes and, most importantly, peace of mind. Your health story matters, your voice matters, and here we deeply believe that every health choice you make should be guided by knowledge and empowerment, not by fervor or simply by habit. If you've ever felt strange after a scan or test, or watched a loved one go through something unexpected, please drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. And if this video helped you feel a little more aware, more in control, or just more curious about your health journey, subscribe to Wise and Well. We're here to uncover the truth, ask the hard questions, and always put your well-being first.